Before you swallow another calcium pill, take just 3 minutes to find out, do you even really need it? There's no app to download, it's totally free, and super easy to find out. Let's do it together. The calcium pill business is a $6 billion cash machine. And if you need a supplement, great, go ahead and take it. But taking more than you need can leave you with kidney stones or other unwanted damage to your body, instead of stronger bones. I'm Dr. Banasali with Plant Forward MD. I treat patients with different types of arthritis, including autoimmune disease. But healthy bones are the foundation. Whether you're in your 40s, your 50s, 60s, or like my parents in their 70s, you still need good, strong bones. A lot of people think calcium is just for bones, but actually it's important for your muscles, your nerves, and even your blood vessels. If you take too little, your bones can be crumbly or basically not as strong as we want them to be. And if you're taking too much, especially from those mega dose pills, you could get kidney stones or increase your risk of heart-related problems. So balance is everything with calcium. So how much calcium do you actually need? It depends if you're a man or a woman, and it depends how old you are. So for men, pretty much from the age of 19 to 70, you need 1,000 milligrams. Over 70, whether you're a man or a woman, you need 1,200 milligrams. But what about women? Before menopause or before the age of 50, you need about 1,000 milligrams of calcium. But if you're over the age of 50, you need at least 1,200 milligrams. But okay, forget the numbers. Let's look at your real life intake. It's so easy to do. There's no sign-ups, there's no spam-related emails to this. You're gonna do it yourself and it's just a couple minutes. Let's go. Okay, let's do a quick diet. Let me show you what I ate yesterday and if I got enough calcium or not. My goal was 1,000 milligrams according to my age. I'm happy to hit more though. So for breakfast, I had overnight oats. And in it, I used soy milk, but not just soy milk, I used fortified soy milk, as well as half a cup of rolled oats and berries, as well as chia seeds, 2 tablespoons of those. So with all this, because of the soy milk, I got 300 milligrams of calcium. Adding in the oats, that was another 25 milligrams, and then the chia seeds, that was 180 milligrams of calcium. Not to mention all the fiber I just got, but that's beside the point. Mid-morning snack, I happen to love wasabi almonds. They just have this great kick. That's another 80 milligrams of calcium right there. Then we head to lunch. I had this kale and quinoa bowl. It may not sound interesting, but let me tell you, the tahini dressing makes it all worthwhile. The cooked quinoa, which I often have in my fridge already waiting, makes it easy to meal prep, has 30 milligrams of calcium, but the tahini dressing also has 60 milligrams of calcium. So I'm already doing pretty well heading into snack time, which was a yogurt. And actually, whether it's a plant-based or dairy yogurt, you can still get plenty of calcium. And for me, that yogurt was 150 milligrams of calcium. So we're really adding up over here. Okay, let's get into dinner. I had a tofu and broccoli stir fry, one of my favorite dishes, and I am capable of eating a lot of tofu. So this whole package is about 600 milligrams of calcium. I had half of that, so I received 300 milligrams just from the tofu itself. But then on top of that, the broccoli also had some calcium in it. Not as much, but still a solid 60 milligrams. So now our calcium calculation. That's almost about 1,350 milligrams of calcium. So not only did I go over my 1,000 milligrams, but I actually, if I was older or I needed more of it, I also went over the 1,200 milligram ratio. And if you weren't hitting it, you could also do little things like a glass of orange juice, but fortified orange juice. While I don't love the amount of sugar in it, if you really need your calcium, it's another good way to get it. So are fortified breakfast cereals. If you happen to love them, I know they're not the best for you, but still they do have some fortification of vitamins and minerals. And there's other tricks in there too. But you can't walk around all day calculating your calcium. That's just gonna be too much. So it's better to kind of take a daily average of your own habits. Okay, now let's try to calculate your calcium. I promise you this is gonna be super quick. Okay, so if we go to our trusty Google, we're gonna put in calcium calculator. And the first thing that pops up is the International Osteoporosis Foundation. So we're gonna click on that. We're going to go to our country. I'm in the United States, and I had a patient come in last week and she really wanted to know because she had just started menopause. She was 52 years old. She had just started menopause and she had never been diagnosed with osteopenia or osteoporosis yet. We were going to go ahead and get a DEXA scan, but she wanted to kind of know if she should take any calcium just based on her age at 52. So if you remember correctly, I told you you have to be about 1,200 milligrams a day of calcium. That's what is recommended if you're 52 years old and a woman. So she told me that milk she likes to drink daily. She does like to stop in and get a milkshake about once a week. In her coffee, she does put oat milk, probably comes out to about 1 cup of in the entire week. Yogurt, she's a fan and does not prefer putting fruits in it. In terms of cheese, she does like fresh cheese. Ricotta is her favorite, she told me. And she puts that about 3 times a week, including in her lasagna. She does love ice cream. That was her thing. Put it in as 3 times a week. But she also has, when she's making it for her kids, she has waffles about twice a week. In terms of her meat, fish, and eggs, She does like eggs. She eats them about 3 days a week, about 2 eggs each time. So we'll put 6 servings. Beans and lentils. Occasionally she does eat sardines, she told me, but otherwise she really doesn't like any of the others here in that category. Beans and lentils, she told me that she loves hummus and probably has that several times a week. And they make chili. She makes a bean chili about once a week. Is a big fan of pasta. Sometimes she eats it at home, sometimes she eats it out. So this is for when she's making it at home. She's a big fan of fruits, not so big a fan of vegetables. So she eats about 5 oranges a week. She does love apples and figs. The vegetables, like I said, she's not a big fan. She will have broccoli about twice a week, she said, just because she's trying to show her kids that it's good to eat them. But otherwise, not a big fan. She does, however, love nuts and seeds. That's kind of more in her Nutella though, and tahini paste in her hummus. Not a fan of quiche, however, she does love pasta and she does love pizza. So she said she does get it from outside about twice a week. Pizza and her family is about twice a week. And she does have a cheeseburger about once a week. She'll have tofu a few times, is not against it by any means. She's not a fan of seaweed and wakame. So she's actually 1,101 milligrams. It's not so bad, right? Her goal is really 1,200 milligrams a day. That's what is recommended for a 52-year-old woman. And what this kind of tells you over here, so she is almost there. So does she have to take a calcium supplement? No, she does not. And if she just upped it a tiny bit, when we did this, she was so excited as she was so close to it that she's like, okay, hold on, let me go back to the list and let me look at the desserts. Okay, she's like, I think I can put in a vanilla pudding this week and that will help me get really close to my goal. So that's vanilla pudding is 120 milligrams of calcium. So just by looking at this, you can really, really increase your calcium intake and kind of know what you're taking instead of just being told that you need to take this much and you better take a pill. If you're under target, fix your food first before you head to the supplements. Because collard greens, if you like them, are about 260 milligrams of calcium. Calcium fortified tortillas, yes, you can actually buy tortillas with more calcium. They can have about 170 milligrams each. And sometimes it's hard to stop at just one. Rice pudding actually has a surprising amount of calcium in it, at 210 milligrams. Okay, but sometimes supplements do make sense. I also have a bunch of questions people have asked me recently that I'm going to talk about in just a minute. But first, when do supplements actually make sense to take? Anybody that's hitting under 700 milligrams despite effort, or somebody who has had some sort of surgery that reduces absorption. A lot of people with gastric bypass surgery really need help when it comes to nutrition, nutrients, and absorbing them. Postmenopausal women that have osteoporosis or osteopenia. You saw that when we did the table, we chose the option that said we don't have it because this lady had not been tested yet. People who have long-term steroid use or proton pump inhibitors, which are acid blockers. And this is really common. Look in your cabinet. Have you been taking omeprazole, pantoprazole, Nexium? There are so many different types out there, and they do block the acid, but they also reduce the calcium absorption. Now, if you really need them, you can't stop them. You have to talk to your doctor about that because some people will need them. I definitely have patients who come to me and say, okay, first thing I'm gonna do is stop my PPI, the acid blocker. But that may not be the right thing because you may really need it for your stomach, your lining. You need to survive, you need to not get ulcers, and you need to feel good. So you may need that medication. If you don't, this is a good time to kind of take a step back and be like, why am I on this again? And is it really necessary? Because people do get put on it and never get taken off sometimes either. Okay, if you're going to take calcium supplements, please, please, please do not take those super mega pills that are 1,200 milligrams. You want to do split doses or just take one of them. Your body really can't absorb more than 500 to 600 milligrams at a time. So even if it says that on the bottle, that doesn't mean what your body is doing is absorbing all of that. We don't really know how much it's actually getting. It depends on so many factors. But rule of thumb is it gets about 500 to 600 milligrams at a time. So don't head for a supplement more than that. You can pair it with vitamin D and K2. That can help absorption. Magnesium, there have been studies that say that it helps with absorption of calcium, and more recently there was a study also that said that it's not helping, and in fact it could be kind of competing against it. So you could take the magnesium afterwards. Also, if you're taking high oxalates like spinach, phytates, which are beans, or too much caffeine or sodium, that can steal away the calcium. So be careful with those two. Okay, what about men? You might be thinking, why are they so lucky that they don't have to take so much calcium? And we don't really worry about them after menopause because they don't have menopause. Men do keep their bone longer thanks to testosterone. So they usually don't need more than 1,000 milligrams of calcium until after the age of 70. But by 75, Mortality for men when they have a hip fracture, meaning their rate of death, is higher than women, almost double. So men, go get your calculator out too. What about if you don't have dairy, if you don't eat meat? There are plant foods that can give you good amounts of calcium, and I've named just a few before. But don't forget, bones love load-bearing movement. Yoga, for example, is great. 2 easy poses are warrior pose and chair pose. Try those out. Okay, here are some questions that I frequently get. What time of day should you take it? I love bedtime dosing best because you may not need the calcium. And if you do and you've thought that you may have not had the best diet that day, it's okay to take just a 500 milligram calcium chew as a caramel chew. They come in many different flavors nowadays and they're tasty, good for after meals like dessert, and you may not actually even need it. What about the heart risk? Well, we don't really know. The data is very mixed on this, but certainly the people that run into problems are the ones that are taking high doses on top of a calcium-rich diet. We don't usually see this in people that are just getting the appropriate amounts of calcium in their diet. So it's all about balance. Okay, if you've gone ahead and done the calculator, I want to see what your number is. Post it below, and one step that you might do to improve your calcium. Find a food tweak that you're willing to try if you're not hitting your calcium goal. Share this with somebody who's guessing their calcium levels and trying to take supplements when they may not even need it. Remember, this video is educational and not personalized medical advice. Talk with your healthcare team on individualized guidance and what really works for you. Until next time, I'm Dr. Banasali with Plant Forward MD.